Hi, my name is Lindsay Crater, and I'm going to be talking about nurses. I interviewed Sherry Mann, and Miss Mann currently works at Southern Village Pediatric Care in Chapel Hill, North Carolina, and she is an LPN, which is a licensed practical nurse, and she got her degree at Durham Technical School in Durham, North Carolina, and has been a pediatric nurse now for about 15 years. From Miss Mann, I've learned that there are many different types of nurses. There are LPNs, RNs, which are registered nurses, nurse practitioners, traveling nurses, public health nurses, and many more. But the two most common ones are LPNs and RNs, and from there you can usually choose your field of study of what you want to go into. And to become an LPN, it usually takes about a year or so out of technical school to get your certificate, which needs to be renewed once every year, usually on or around your birthday. And LPNs tend to work in places like Southern Village Pediatric Care or nursing homes. RNs, on the other hand, usually takes about 3 or 4 years to get their degree, usually at a university, and since they do have more schooling, they tend to have more responsibility than LPNs, so they work in hospitals because they're certified in working with most of the equipment in hospitals. But the basic job description for all nurses is to screen the patients before the doctors see them. And what I mean by that is by taking their height, weight, blood pressure, temperature, medications you're on, symptoms you've had, how long and how severe the symptoms are, and record them in your medical file for many reasons. One is so that the doctor can review what is going on with you, so by the time they see you, they have a better understanding of what is going on with you so that they can diagnose and treat you as quickly and as efficiently as possible. Another reason is for liability and insurance reason, because if you document everything that you've done, all the steps you've taken to treat a patient, if you are sued for negligence, then you can prove that you did not breach your duty of care and that you've done everything that you could to treat your patient that was medically acceptable to help you get better. So in a way, documenting everything that you're doing to treat your patients is also protecting yourself due to harm from suing. And Miss Mann says, though, that the most difficult part about being a nurse isn't really the paperwork, it's dealing with difficult family members, because children who are sick, the parents or guardians are very worried about them and just want them to get well as quickly as possible. And if they don't see the doctor right away, they could start to become frustrated and they could take your frustration out on the nurses. But Miss Mann says that what she tries to do is tries to keep them as calm as possible and reassure them and let them know that even though the doctors are busy, they will get to your child as quickly as possible and just try to overall calm them down. In conclusion, I've learned that there are many different aspects of being a nurse, not just paperwork. Like I said, it's almost like being a counselor for a family member of a sick child, that you just want to keep them calm and make sure that they're not scaring the children who are sick if they're really worried about a doctor coming or not. So you just need to make sure that they're focused on the child and not just being frantic. But Ms. Mann says that nursing is a very rewarding profession because she really likes to care for people, especially children. And so being a pediatric nurse, she's able to do what she loves, and that she really loves the face-to-face interaction because she's not big on sitting behind a cubicle for 8 hours just looking at a computer. She likes being able to talk and interact with people, and nursing, you're able to do this. That's one of the reasons why I want to go into the medical field and become an occupational therapist, is because I also like that face-to-face interaction. And if for whatever reason I don't become an occupational therapist, I will really look into becoming a nurse, because it seems like it's a very rewarding, fun profession to get into. And from this interview, it was very informative and very enjoyable, and I have a newfound respect for nurses.